You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. So, the both of you, thank you very much for joining us. If you could just introduce yourself to our listeners and tell our listeners a little bit about yourself to start things off, that'd be really good.
I'm Carole. I come from Durham, and I'm a fencer. Although I'm very old, and I enjoy it very much, and I believe you have people who live in your area who are also fencers. And I've also been a sufferer from hay fever for most of my adult life, and I've found things like using the salt pipe has given me a great deal of relief and help.
Yeah, my name is Rit Sutera. I'm the people who brought the salt pipe into the UK in 2005 and it become very useful for the people here to getting know about salt therapy by using this small gadget, and we are here for helping people for respiratory problems.
Well, yeah, we're talking about respiratory problems, and I was hoping you could tell us some of the issues and impacts of everyday life with a respiratory issue.
Well, I think in the winter time, the things like coughs, colds, flu, which seem to be leaving people. I don't suppose there's hardly anybody who's listening who hasn't experienced it themselves, or maybe a member of their family has had some sort of respiratory issue over this winter when flu has been so prevalent. There are a lot of asthma sufferers in this country. Asthma is definitely on the rise. There are people in the summer who suffer from hay fever and allergy problems. And there are also older people, or maybe younger people as well, who suffer from chronic illnesses like COPD, chronic obstructive respiratory problems.
So how can someone with respiratory issues still sort of enjoy and have an active life?
Well, I think by taking precautions, if you're an asthma sufferer, it's really very important that you get your flu jab, for instance, and, try and prevent things getting worse. And by using the right kind of medication or therapy that's going to relieve the symptoms and allow you to get on with an active life.
Now, you mentioned about salt, I think, when we first started talking, Charles. I hope you could tell a bit more about salt therapy.
The salt therapy has been very well known in Eastern Europe because it's the natural treatment that the people usually going to the salt clinic or salt sanatorium in order to inhale the salt air. It has been used for long times for the treatment, but it's not very well known in England because no salt cave around here. And the people usually inhale the salt air from the cave, and the salt has the antiseptic property, and it can help to clean cells inside the lungs when the people have lots of phlegm and things, and loosen the phlegm inside the lungs and make they can breathe much easier. And because the salt inside the salt cave, it been formed 300, 400 years ago. So, and it contains lots of minerals, and this mineral can help to reduce some inflammation and make more relaxed for the body much more. And the salt therapy, usually you have to go to get the treatment, but with the salt pipe, is a dry salt inhaler that you can use this kind of therapy at home. That is a little gadget that you inhale the air from the pipe, look like the little container with the mouthpiece, and you suck the air from the pipe. The air passes to the salt crystal, absorb lots of mineral, and go to the lung. It's quite the same concept of the salt therapy. Yeah.
And do you find it works well?
it's really helpful. So in terms of people who have problem with asthma, with our experience with the salt pipe, lots of people find it helps to relieve and they can reduce some medications. And also people who have problem with cold, chest infection, it also helps to make them recover much easier because the salt, it has antiseptic property. So it looks like a little thing to work with the infection inside the lungs. And also it doesn't have any side effect. This is the most important thing for the use of the salt therapy and the salt pipe, yeah.
What else can people do to relieve and prevent respiratory issues?
Well, I think as I mentioned before, if you're an asthmatic, it's really important to have your flu jab and try and, sort of prevent illnesses, winter illnesses like that. It's a really good message to put out. If you know you live in a polluted area and sometimes you find yourself finding it difficult to breathe or your eyes are burning or your sinuses are troubling you because of the pollution getting inside, use of the salt pipe can be very, very therapeutic.
So is there anywhere else our listeners can go to find out more information if they found what you said of interest and they'd like to find out more?
Yes, we have the website, thesaltpipe.co.uk, and people can go to find information about what is the salt pipe, the history of the salt pipe, and how the salt pipe can be beneficial for you to use it, because lots of feedbacks from the customer over there. And also you can follow us online on Facebook at Cisca Saltpipe, that it can be lots of discussion about people who use the salt pipe, sharing experience and lots of topic about how you can maintain your respiratory system by using the salt pipe and the salt therapy.
Well, I'd like to thank the both of you very much for taking the time out to talk to us here at BRFM Bridge Radio on the Daniel Monday Night Community Show.
Thanks very much.
Thank you.
Thanks for that. Thanks for your time. Thanks. Bye.